Hey guys, so this is part two of our podcast, and this podcast we're going to cover Adderall use and effects.
So, the therapeutic use. So, Adderall has generally been used as a medication to treat attention deficit hyperactivity disorder. Um, it's classified as a stimulant and it is used to increase more cognitive abilities. So, things such as paying attention, focusing, controlling problem behaviors, organizing tasks, and improving listening skills. In other cases, it's also been used for narcolepsy, which is a disorder in which the individual has a hard time staying awake and is constantly sleepy.
So in this graph we have some different ADHD drugs. We have some Ritalin and Adderall as well. Um, in the top line here we have 12.5 milligram of Adderall BID, so twice a day. So this drug here, again, you can see in the graph, has the highest effect size. It also has the quickest onset, so um, in that 1 hour period, it's going to have the greatest effect size over both Ritalin and a lower dose of Adderall. So we can use this kind of chart to kind of treat people who have ADHD as well. So here's a picture showing brain activity with Adderall. So people without Adderall, they typically have less functioning in their frontal lobe, and whereas people who are on Adderall have an increased metabolic activity in their frontal lobe, and this frontal lobe has to do with cognition and memory, as well as higher order thinking and different processes that affect our daily functioning. So people with ADHD generally have less metabolic activity in this frontal lobe. So the idea of this drug is to increase that metabolic activity so they can focus their attention better and they're not as distracted or hyperactive as they usually were. So this also here shows some different releases. So Adderall has different types of um, release kind of drugs. So there's Adderall XR, which is extended release. This drug, basically you take it and it has sort of a bolus effect. So you get an initial dose, and then throughout the day it slowly has more dosing. And this, for this reason, it usually prevents super high spikes in blood Adderall like levels. So that way, people don't have increased levels of Adderall in their blood, and they're having side effects or more stimulated quicker. So this way, it's more of a slower kind of release. That way, they don't have as many peaks and valleys in their treatments.
So, long term use and side effects. So, Adderall's use is for cognitive purposes and it affects other areas as well, like in your cardiovascular system as well. So, things such as heart disease is more prevalent, high blood pressure, anorexia, and there's also things like sleeping disorders and whatnot that we've learned earlier. So like narcolepsy is treated with Adderall at times. Um, so for things such as narcolepsy, Adderall is a stimulant which increases brain activity. So it helps the individual to not just fall asleep. So there's always activity in their brain. Other things such as sudden weight loss or sudden weight gain can be seen because it suppresses the appetite of the individual. So when they're no longer on the medication, they can see a rise in their appetite and whatnot, which will lead to the sudden and unexplained weight.
Yeah, yeah.
And the reverse could be, or inverse, it would be weight loss, or
because Adderall suppresses your appetite.
Yeah. And then increase in heart-related risks such as heart disease because the heart is consistently being stimulated, which will cause issues in the individual. So the withdrawal of Adderall. So we can see here in the first few days and then the following at the end of the week, you can see that there's specific symptoms or things that the user will experience, such as fatigue, cravings, depressions, irritability, all these things up here, sleeping disorders, exhaustion. For week two, they will start to start to so yeah, during the week two, we'll start to see some of these symptoms dissipate, and then on to week three, and then week four, they all slowly basically go away. But in week four, generally there's issues like more sleep disorders, brain fog. So an individual is starting to get back their ability to think properly and perform cognitive functions without the use of Adderall.
So we have some like certain implications regarding reproduction. So oftentimes, men will have become sexually impotent. They'll have decreased sperm count. They may have erectile dysfunction. Women might have some menstrual issues. They'll also have accumulates Adderall accumulates in their breast milk, so it can cross over into the breast milk, and this can actually cause problems with the fetus. So the fetus can have some long-term abnormalities, specifically behavioral abnormalities, as well as it might have a low birth weight or there might be a premature delivery. And mainly this is just because if the mother takes Adderall while she is having, like she's pregnant, it'll cross the placental barrier and it will basically cause the same effects to the fetus, which is not developed yet, and cause some abnormalities there. So with this picture here, we have some similar structures. So often many people are familiar with meth, and if you look at the structure of Adderall, you can see it's pretty much the exact same with the exception of this little hydrogen here. And it's pretty similar as well as another common ADHD medication, Ritalin or methylphenidate. And these drugs as well, they're very similar to crystal meth. So if you think of um, like effects that crystal meth has, you can almost predict the effects that Adderall will have as well. And again, you can kind of see with this the methamphetamine, it has this CH3 over here, and it's a little bit different, but again, it has the same ring structure as Adderall and Ritalin as well.
So routes of administration and general instructions. Adderall is generally medicated orally, 1 to 3 times a day, and there's usually 4 to 6 hours in between each time. Generally, the instructions will tell individuals to avoid taking it late in the day because it will cause sleeping problems. And there's other routes as well in which it can be administered: sublingual, which is under the tongue, insufflation through the nose, and rectal as well. These are generally more for more immediate effects, whereas orally it might take a long time of because of first pass metabolism.
8 minutes.
So one of the many uses of Adderall, especially for in education, is because students believe that it's some sort of benefit academically for them in like high school or college or whatever it is. Many students that engage in the use of non-medical prescription Adderall cite beliefs about academic benefits. So they started to. So in this study, students that started and continued the use of non-medical prescription Adderall saw no improvements in GPA from years 2 to 3, while students who abstained from using it saw increases to GPA from year 2 to 3. So in this study, we can see that there's actually no academic benefits for students that used GPA. So this study also found placebo effects. So they compared a group that received the stimulant Adderall and compared to a group that received a placebo, and they found that there was actually no differences between the groups. If anything, there was a marginal difference. So this kind of concluded that there was no cognitive benefit or academic benefit for these individuals that did take Adderall. So this concludes our part 2 for Adderall. Stay tuned for our part 3 where we discuss the mechanisms of action.